continuous BTK inhibitor therapy is continuous, meaning that patients do take these medications for long periods of time. And so there are lots of costs that are associated with that. Costs associated with just routine medical care related to doctor's visits, costs associated with any adverse events that happen. And then the cost of the drug itself also comes into play. So we did a financial analysis to look to see, well, what are the differences in cost? And what we found was that for patients treated with Acalabrutinib in both the frontline and the relapse refractory setting, there is less cost associated with adverse events compared to both Ibrutinib as well as Zanubrutinib. And overall, even taking into account total drug cost at baseline, there really was a favorable cost profile for Acalabrutinib monotherapy when looking at continuous BTK inhibitors. So with the presentation of the amplified data over the past year, I think that the big question in my mind is how is the combination of a BTK inhibitor and a BCL2 inhibitor with or without an anti-CD20 monoclonal antibody going to be incorporated into treatment, frontline treatment for patients with CLL? What we've seen is that these doublets, these all-oral doublets, are very effective, and the addition of obinutuzumab to an all-oral doublet does improve overall response rates and depth of response, but does come with a risk of toxicity, which was really seen in Amplify, particularly with an increased risk of death from COVID. And death from infections is a very important issue for our patients with CLL due to the complex underlying immune dysregulation that we see in both B and T cells in our patients. And so how these combinations are going to sort of be adopted, I think, is really important and something I'm curious to see. We don't have FDA approval yet for the combination of Acalabrutinib and venetoclax with or without obinutuzumab, but I'll be intrigued to see what these data look like long term and really where that regimen starts to fit into our treatment for patients with CLL.